Imagine waking up to a world that violently and continuously vibrates. This is the reality of oscillopsia, a condition where your surroundings never stop moving, making it impossible for your eyes to lock on to a single point of focus. Yet, this isn't a universal experience for everyone with darting eyes. Many people born with congenital nystagmus live in a world that appears perfectly still, despite their eyes never remaining stationary. Their brains have adapted to function as an automatic video stabilizer, smoothing out the erratic motion of the eyes before the image is even processed by the conscious mind. This reveals a core truth of human vision. Perceiving a stable world isn't about having perfectly still eyes. It's about the strength of your internal video editing system. This system has a mechanical threshold. The brain can only cancel out motion if the image slides across the retina below 5 degrees per second. But when nystagmus is acquired later, or internal stresses cause a physiological shift, that limit is breached. Once the motion crosses that threshold, the stabilizer fails entirely, and the world begins to shake. To stop the vibration, we have to look at the specific characteristics of the visual motion to reverse engineer which physiological system broke the 5-degree rule. The investigation begins with the patient physically tracing the direction of the movement. They describe whether the world is bouncing, sliding, or twisting. If that twisting motion is isolated to one eye, it is classified as monocular torsional oscillopsia. This points to superior oblique myokymia. It occurs when a pulsating blood vessel pushes against the fourth cranial nerve. That compression triggers a misfire down the nerve, forcing the superior oblique muscle to twitch and making the eye twist uncontrollably. The geometric path of the visual bounce effectively serves as a pointer toward a microscopic failure in a single cranial nerve. The focus shifts if the shaking isn't constant, but rather triggered when the patient stands up or turns their head. Movement-induced shaking suggests the root cause isn't the eye, but a failure in the inner ear. When ear crystals are displaced, they trick the otolith organs into sensing a rotational acceleration that isn't actually happening. This damage results in the loss of the vestibulo-ocular reflex. Normally, this system counter-rotates your eyes to compensate for body movement, but when it fails, the eyes lazily drag along with the head instead of locking onto the target. When the vibration is tied to physical movement, the brain's internal gyroscope has gone offline. There are also cases where the vision shakes constantly in all directions, and the sensation persists even when the eyelids are closed. This pattern, known as pendular nystagmus, suggests a deep failure within the central nervous system, often associated with conditions like multiple sclerosis. The underlying failure is revealed by the environment. If the patient enters a hot room, the nystagmus physically increases and visual symptoms rapidly worsen. When the shaking is constant and amplified by heat, it indicates a systemic failure deep within the brain's circuitry, rather than an isolated nerve or ear defect. Oscillopsia is more than a random visual glitch. It provides a specific readout that tells us exactly where the body is failing. Once the source of the failure is identified, we can begin to address the unmanageable, using nerve compressions like superior oblique myokymia as the template for treatment. Clinical interventions range from anti-epileptics and beta blockers to surgical decompression of the affected nerve. But even with these intense medical interventions, the goal isn't necessarily to achieve 100% stationary eyes. We only need to slow the shaking down enough for the retinal image slip to drop back below the 5-degree per second mark, settling back into that safe green zone. Perfect gaze stabilization isn't a requirement for clear vision. We just need to get the shaking slow enough for the brain's internal software to edit the footage and make the world stand still again.